Welcome, and thank you for joining us this afternoon for the Medicare Workshop. My name is Kathy Chern, and I am a consumer health librarian at East Brunswick Public Library. Today's program is brought to you by the library's Just for the Health of It initiative to promote community health and wellness. Our speaker today is Mike Salum, a Medicare planning specialist with most of the top A-rated insurers. Mike has over 35 years experience working in the corporate world, with 27 of them spent on the floor of the New York Stock Exchange, many of them as a floor manager for one of Wall Street's top investment banks. Please be aware that this talk is being recorded. Please keep your microphones muted and your webcams off. The recording will be available at ebpl.org/YouTube. If you have any questions, please type them into the chat box. Our speaker will answer questions at the end of the talk. And without further ado, I'll turn things over to Mike.
Thank you, Kathy. As usual, it's a pleasure dealing with the East Brunswick Public Library and yourself. Hello, folks. As Kathy was saying, my name is Michael Salum, and I am a consultant and advisor for Medicare. I am not affiliated with CMS or any Medicare, government agencies or anything. I am simply a consultant, and I answer all questions, and I help out folks with their work, exactly what they might need within the Medicare world. What I like to do with these presentations is basically teach people about Medicare, the do's and don'ts. We'll skip through this as Kathy has already spoken about it with me, and thank you very much for that, Kathy. What I do is I educate folks on Medicare. Okay, I offer free workshops. I offer free consultations. I don't charge for anything for any consultations with with anybody. And what I like to do, as I mentioned, I teach about Medicare. There's a lot of do's and don'ts in Medicare, and you have to be very careful. If you're not careful with whatever product you choose with Medicare, you can spend quite a bit of money. I do provide options, whether it's whichever insurer that you might want to see about. Aetna, Cigna, Horizon Mutual of Omaha. I deal with all the top A-rated companies in the United States. So I assist with enrollment. I assist with enrollment for your Part A, your Part B. I also talk about Medigap plans, Medicare Supplement, which is a Medicare Supplement plan that's synonymous, Medicare Advantages, and then also your Part D. And your Part D, as you will see, it's it's the type of program that you must be very, very careful with. It's a very individualized program as far as your RX plans go. Each state has about 35 different plans, and if you choose the wrong plan, it could cost you thousands and thousands of dollars. And of course, throughout the seminar, I will be talking about that. Okay. I will cover Medicare and Medicare Supplement plans and Medicare, and I will briefly discuss Medicare Advantage plans, as I cannot get into specifics about Medicare Advantage plans, but I can give you an overall assessment of them. We will definitely be talking about prescription drug plans, which, as I mentioned before, that is one of the most critical parts of Medicare if you choose the wrong one. And then we're going to go over just briefly what the top 5 mistakes that people make. And you will see on some of my slides where I do have the numbers correlating to the top 5 or the mistakes that people might make during Medicare. Okay, so now let's go into the parts of Medicare. Okay, now the Part A of Medicare is hospital insurance. All right, what the Part A of Medicare does is any kind of inpatient, like at a hospital or anything like that, that will be taken care of through your Part A. Okay, skilled nursing facilities, hospice, any certain home health care services is covered by Medicare. Usually there's no premiums for the Part A. If you would need to work 40 quarters in the United States and pay your taxes in 40 quarters or 10 years, and that you will get Medicare Part A free of charge. Okay, some people that don't qualify for Medicare for the hospital or the Part A, if you were to purchase it on your own, you could, but you're looking at about $460, $470 a month just for the Part A of Medicare. So we're lucky with that part. We don't have to pay for it. Okay. The next part of Medicare is Part B, which is your medical insurance. Okay, medical insurance or the Part B is anything that's outside of the hospital. Okay, whether it's your doctor visits, any testing specialist doctor visits, any kind of testing they might send you to, blood work, MRIs, CAT scans, et cetera, et cetera. Diabetes Medicaid, well, diabetes, I should say, equipment, things like that. That's all covered under the Part B. Durable medical equipment, whether it's a wheelchair, canes, things like that. That's all covered under the Part B of Medicare. Okay. Now there usually is a monthly fee for your Part B, and it's normally the amount for most folks is $148.50 a month. Okay, but it is income adjusted. It's IRMA. It's IRMA adjusted, which is income related monthly adjustments, and you'll see in a couple of minutes in my next slides. Most folks do pay the 148.50. Now, if you're collecting your Social Security benefit and you start and you go into you get your Medicare, your original Medicare, which is A, B, and D. So if you get your original Medicare while you are collecting your Social Security benefit, then the Part B monthly pay premium is automatically deducted from your Social Security benefit. If you're not collecting your Social Security benefit and you are under original Medicare, then that fee you will be billed quarterly for the month for the premium for the Part B. Okay, I'm going to skip C and I'm going to go over to D a second because A, B, and D work together. That's called original Medicare. Now the Part D of Medicare, D as in David or drugs, is that the prescription drug coverage. And as I mentioned before, there's about 35 different programs per state. It's run by private insurance companies. That helps cover the costs of your your prescription medications, and there's variations of the drug plan, but there are usually it is a government and state regulated program, but they do have variations depending on the insurer themselves, and I will go over that when it comes time for the prescription drug section. Now there usually is a plan premium. For these plans, it could be as little as $7.30 with the Silver Script plan. It could be as much as over $100 for maybe one of the Horizon plans, that's available. It is income adjusted also, as you'll see in a few seconds. We're going to go over that, how the pricing goes, and it is again, it's income adjusted. The Part C of Medicare, which is it's really a misnomer because it's not really part of original Medicare. Okay, the Part C of Medicare is what's called the Medicare Advantage. If you're familiar with an HMO or a PPO, that's exactly what it is. Okay, it takes over for A and B, parts A and B, and in most cases D. Okay, it is privatized, so it's run by individual insurance companies. Okay, and most of them offer the Part D coverage is all automatically included with the Medicare Advantage plan. As I said, it is a privatized plan, so you would have to go to whatever doctors are available within that plan, whether, let's say, for instance, if it's United Healthcare or an Aetna plan product, then you would have to go to those, UHC's doctors or Aetna's doctors, like that. Medicare Advantage plans do have to take most of the whatever original Medicare gives you. They have to implement that within their products, okay? And they do have certain variations. With Medicare Advantage plans, you do have a higher out-of-pocket expense, okay? You'll see, we'll go over that in a few. The pricing varies by plan. Most plans are zero premium, so you pay nothing for them, and in some cases, they would give you a monthly premium you would have to pay. If it's a PPO plan, PPO, you can go to different doctors, maybe not in the network. Some of those products are priced on a monthly premium, but you do have a higher out-of-pocket expense on some of those. Okay. Now, as I said, the Part B of Medicare is a monthly adjusted premium monthly adjustment. It's the income. It's called the IRMA, and it's the income related monthly adjustment amounts. Okay. So now if for 2021's premiums, now this goes back to the last tax year that's on file, not 2020. So this will be under 2019. Let's say, for instance, you earned as an individual filer, you earned under $88,000. Then your monthly premium will be that $148.50. If a joint filer, for husband and wife or spouses, if you earn under the limit will be $176,000 a year, and that goes under the MAGI, which is the modified adjusted gross income. Okay, that's the adjusted gross income. That's the certain bill payments that are going in there, and then the modified adjusted gross income is from there. Please don't ask me about that. I'm not a tax guy, far from it. So you can talk to your tax guy, but those figures is from a modified adjusted gross amount. It's not your actual income. Okay, so if you'll see on tier 2. If you look at tier 2, so now if you earn individual filer from $88,001 up to $111,000, and if you're filing joint, it's $176,000 from one to up to $222,000, then your monthly premium goes to $207.90. And as you can see, tiers 3, 4, 5, and 6, how the monthly premium goes up. Now, once again, as I mentioned before, if you are collecting your Social Security benefits, then these monthly premiums will be deducted from your Social Security benefit. If you are not collecting your Social Security benefit, then you will be billed quarterly for your Part B premiums. Okay. Now, here's one thing that's very, very important for folks. Okay. And this is something that please note this. I mean, we turn 65, we retire. Okay. Sure, we were earning couple of $100,000 a year at that time. So 2019's income, your income tax is it's going to show how much your earnings were at that point. Okay, so you look at it possibly $300, $297 if you with your Part B premium. Okay, but when you apply for Medicare as A and B, and Medicare is going to send you a letter and letting you know exactly what your monthly premiums for your Part B is going to be. Okay. They also give you a 60-day window in order for you to appeal that amount. And you can let them know, listen, sure, in 2019, I was working, I was earning X amount of dollars, but I'm retired now. I'm not going to be earning that kind of money any longer. My monthly MAGI, or my monthly adjustment, my adjusted gross income is going to be, let's say, under $88,000 now, okay, or whatever that figure is. They will adjust the amount to what you tell them it's going to be, okay, and be absolutely sure that whatever you will say to them, that's what it's going to be, because if not, they will bill you for the balance once they get that figure. So what you do have, like I said, you have a 60-day window to appeal. Now, my suggestion is you call them up, let them know that you're going to be appealing that for whatever figure is you're going to be your projected income for the let's say 2021, and then send them the letter also. The reason I'm saying call them up and make sure you're on file saying that happens, because if you send a letter and God forbid that letter gets lost somewhere in the mail, or your appeal paperwork gets lost in the mail, then you don't have a leg to stand on. Okay, so do your due diligence, call them up, let them know what your filing is going to be or what your income is going to be, and then give them and then send that letter in also. Okay, and that's very important, because again, like, some people were earning good money, but now here comes the times that now all of a sudden you're retiring and you're not going to be collecting that money any longer. So you don't want to be spending $386.10 for your monthly premium when it's not necessary. Okay, so take that to the bank, keep that in mind, and don't forget that part. Okay, very, very important. All right, now, as I said, your Part D premiums is also income adjusted. And it also goes by the IRMA, and it's all through the modified adjusted gross income. Okay. So as you can see, the numbers are actually remain. The filing returns are actually the same. The 88,000 over the 176,000 filing a joint. So if you had that silver script plan, which is $7.30, that's all you're going to be paying on a monthly basis. Okay. But now if you're earning over the 88,000 or over the 176,000, so now it's $7.30 for that silver script plan plus $12.30. So you're going to be looking at $19.60 a month, and so on and so forth. 31, whatever the monthly premium plus the 3180 for tier 3, the monthly premium plus 5120 for the monthly for the tier 4. So what are you looking at? It's 5120 plus the 730. Now you're looking at 5850 for that premium. So again, you can adjust that also with the appeal process for the plan. So these are things that you do need to keep in mind. And as I said, if you're looking at a product like Horizon, Blue Cross Blue Shield, Horizon RX plan, which is over $100, and then you're looking at tier 5, now you're talking about almost $200 a month that you're going to be paying for your RX plan. Okay. So next on to the next one. I'm going to go to the number one mistake that people make. Okay. We're going to talk about the initial enrollment period. And this is, like I said, the number one mistake that people make when it comes to Medicare. And it's not knowing when to enroll in Medicare. Okay. The IEP, or the initial enrollment period, it's a 7-month period that Medicare gives you. It includes your birth month. So even if you were born on September 10th, that's your date of birth, you will become Medicare eligible on September 1st. Okay. 3 months prior to September 1st or September, June 1st is when you can start enrolling in Medicare. Okay. So, and then 3 months after your birth month, or up to December 31st, you can enroll in Medicare. It's critical if you're looking to enroll during that time to do that 7th month, to get within that 7th month. Okay. If for whatever reason you enroll in Medicare later than the 7th month initial enrollment period and you do not have credible coverage, you'll be liable for 10% per year for your Part B monthly premium. So that's $148.50 tacked on 10% for every year that you didn't enroll in Medicare when you were supposed to. Okay. If you decide to bypass Medicare and you decide to go and continue to work, you can do this as long as your company has credible, as long as you have your company's group coverage and it's credible, you're okay. All right. Well, I'll go over that in a little bit also. But just keep in mind that this 10% per year, it doesn't go away. That 10% is not a one-time penalty. It's a lifetime penalty. So be very, very careful with when you want to enroll in your Medicare, and when you're going to retire, you want to enroll, when you're supposed to enroll. And there are different scenarios for that. Okay. During the initial enrollment period, what I like to say is, if you're going to know you're going to retire, if you're going to do it, between June and your birth month, September, then September 1st will be your eligibility date. You'll have your Part B and your Part A eligible for September 1st. But if you do it on your birth month, now you're going to have to wait a month past that in order for your eligibility to come in. So now you're looking at October 1st. So it's a possibility you can go with a month without having your any kind of coverage. If you go and decide to do this on September, let's say October 1st, okay, so now it's 1 month past your birth month eligibility. Now you're talking a 2-month wait. So now you have the month of October plus 2 months. Okay, so it might not be eligible till probably December. And if you decide to do this in December, now you have the month of December plus 3 months. So now you could be looking up to March. Okay. And So it's very, very, critical. Whenever you're going to retire, whenever you're going to start your Medicare, figure it out, see when you're going to do it, and then do it prior to the day that you're going to retire, or the day that your credible coverage or your coverage is going to end, so that you won't lapse in coverage. Okay. Another thing, let's say, for instance, you go past, there is an 8-month window that you can actually, it's not going to be initial enrollment, but you can, if it's 8 months after your credible coverage ends. If you go eight months after your credible coverage ends, then what happens is you do not, if let's say you go in, it's going to be April 1st, April 2nd. Okay, you walk in and tell Medicare, okay, listen, I want to get my Medicare, my parts A and B. Okay, well, when was the date of your credible coverage? Well, it was 10 months ago. Oh, so it's past the 8-month enrollment period, that the special enrollment period. It's past the 8 months. So you have to come back on January 1st. Because if you go past that number, those 8 months, now you have to go back January 1st. So now, remember, this is April 1st. So they have to go back on January 1st of the following year. And then guess what? You don't get eligibility to July 1st when that comes in. So you can literally go, what's that, about 18 months, 19 months without any kind of insurance. So this is one of the things that's very critical. Find out, see when you're going to retire, and then submit your Part A and Part B for the time, and try and do it ahead of time. Okay, it could be critical. All right. So now, when do you need to take Medicare? They do have certain restrictions on when you can, when you have to take your Medicare, or when you can keep your employer's group plan if you choose to go past 65 and not get your A or your B, go into original Medicare. So now, let's say, for instance, you're over the age of 65, and by the way, your Medicare eligibility is when you turn 65, your birth month when you turn 65. That's your Medicare eligibility date. Okay. So now let's say you're over 65, or you got your Medicare eligibility month, and you decide, no, I want to keep my group plan at my job. I'm going to continue working. It's working for me. That's fine. But if your employer is has under 20 employees, then you have to get Medicare. Medicare comes first. Medicare pays first. Okay. If you're over the age of 65, again, you're Medicare eligibility, and you're on a group's your plan, or your spouse's group plan, and in this case the employer has over 20 employees, then it's okay. You can keep that group health plan. All right. So you won't be penalized. You will need forms later on, which I will show you what those forms are, where after you decide to pick up Medicare, you decide to now retire, you're not eligible for the group health plan any longer. I'll show you the forms that you're going to need in order to not be penalized at 10%. Remember that. Okay. So let's say you're disabled and you're covered by your group's plan or your spouse's group's plan, and again, your spouse or yourself are going to continue working even though you have the disability. But in this case, if your employer has under 100 employees, then Medicare becomes the primary. So you will be forced to get the Medicare. Okay. And again, if you're disability and you're disabled and your employer has over 100 employees, and again, you want to keep your spouse's group plan, then as long as it's over 100 employees, you can keep that group health plan. Okay. If you're on an employer retirement plan or one of those railroad retirement plans, if you become Medicare eligible, you will need to get Medicare, because they will become primary and that other plan is going to become secondary. So you have to be very careful. Which leads me to COBRA. COBRA, please be very careful. Our pre-65 or pre-Medicare eligibility mindset as far as COBRA goes is, sure, I was working, I got laid off, or I decided to go somewhere else, and I can take my COBRA plan, and you wind up spending 102% of that, because it's whatever you paid through it's whatever you were paying for your medical and whatever your employer was paying. So that's combined together plus 2%. Now you're looking at 102%, which you have to pay for COBRA, which could be very expensive. But here's the key. oh, here's the killer, I should say. If you're entitled to Medicare, Medicare becomes primary. So some people, remember, our 65 mindset is that, well, Cobra is going to be the exact same plan that I had with my employer prior. But now that you're Medicare eligible, Cobra becomes secondary. Medicare becomes primary. So it's called a Cobra trap. And a lot of people have come up with a situation where they've turned around and well, I got my Cobra, I'm okay, but I'm Medicare eligible. Then all of a sudden they end up in the hospital and they send a bill to the insurance company or the Cobra company. And Cobra turns around and says, oh, you're not Medicare? Medicare's primary. They got to pay their portion first before we pay ours. Guess what? You're going to be liable. All right. So please, that's another thing you need. Very, very careful with this, with Cobra. Forget about that pre-65 mindset. You're Medicare eligible. Cobra becomes secondary. Medicare becomes primary. All right, folks, keep that in mind, please. Part B enrollment scenarios. If you're turning 65, this is how you would enroll in your Part B plans. If you're turning 65 and you're already collecting your Social Security income, then you will be automatically enrolled in Parts A and B. Okay. If you choose to work, then you would have to disenroll from B, and that's very important. If you turn 65, you're collecting your Social Security, and you auto enrolled in A and B. People say, oh, that's all right. Well, one thing, you're going to be paying for something that you don't need. You're going to be paying for the B through your Social Security income that you don't need to get, because you're still on a group plan or a spouse's group plan. Okay. And a critical part is, when you get your Part B, if you wanted to enroll right away into either a Medicare Supplement plan or a Medicare Advantage plan, you have a 6-month window to choose any plan with no questions asked. I've had the situation where people have been auto-enrolled in their Social Security, and then they're auto-enrolled in A and B, and now they're off the group plan. So first of all, one, they've been paying for B that they absolutely do not need. Okay, but now they're past 6 months. So now they say, you know what, I want to get into a Medicare Advantage plan because I'm a diabetic and I take, over 50 units of insulin, or I have heart conditions, or I've had, multiple strokes, whatever the case is. But you're not going to be able to get a B because, you're not going to be able to get a Medicare Supplement plan because it's been past 6 months. Okay, since your B was effective. So if you're gonna work and you're collecting your Social Security, you're auto enrolled in A and B, call me up, send me an email. I can send you a disenrollment form, or you can just pick it up on cms.gov or medicare.gov. You can pull it up there and disenroll from the B. It's very critical. All right. If you're turning 65 and you're not enrolled in Social Security, then you can do this online at the following website that I show there, secure.ssa.gov. It takes about 15-20 minutes, and it's very simple procedure. You can auto enroll in your A and B right there if you choose. Now, the scenario where I have mentioned about enrolling after the age of 65, you're Medicare eligible, but you don't have A or B, and you had credible group coverage, you do need what's called CMS forms, okay, which is the Center for Medicare and Medicaid Services. Now, the CMS forms, as I mentioned before, they look like this, and the CMS forms, what they do is that they actually take they don't allow them to take that 10% penalty. All right, it's waived because of these forms. You're showing Medicare and Social Security that you had credible coverage up until whatever time you decide to retire. Okay. Now the form on the right-hand side, on the left-hand side, the shorter form, that's the part that you would be filling out, and that's the part that you will be telling Medicare when you want your Part B to begin. Okay. And then the form on the right-hand side, the longer form, that is filled out by your HR department, and it's signed by an official from your HR department. And as you can see on there, it tells you when you started your group coverage, basically when you started with the firm, when it's going to end, and then the retirement date of whenever that's going to end. Okay, so that gets filled out by the HR department. You take these two forms to Social Security and you submit that. There's no penalty, and then you can tell them exactly when you're going to start your Part B. Now, normally that is when you're let's say you're going to retire in June. So June 30th is your last day of work. So you want your these forms to reflect that your group coverage is going to end on June 30th, and you want your Part B and to begin on July 1st. This way, there's no lapse or there's no difference in time as far as the coverage goes. Okay. Now lately they've been saying with these forms that you can't mail in, is basically you can't even go anywhere with any government agency. So what you do, you're supposed to mail it in. Okay. I stress, and I even before this COVID times, I stressed, make copies of these forms, take the forms, and then mail it in. There was a time, obviously, you can walk it into to the Medicare services. I've had situations, I've seen many situations where a husband and a wife have gone in, they were both on their group coverage. Now they both decide to retire. They've walked in, one with each. And by the way, if it's a husband and a wife, you need each needs to fill out one of these forms, and the HR department has to fill them out also. So I've seen situations where both of them have walked into Medicare, given them the same person, both forms at the exact same time. One person gets processed and the other person gets lost. How that happens, God only knows. So even if you send it through the mail, I would say be careful. Send it through the mail, call them up, find out, but keep the copies, because you never know. If it gets lost, at least you don't have to go through HR and figure out all that, get all these things filled out all over again. Okay. And remember, this is critical. Otherwise, if you don't, if 5 or 6 years down the road, you decide now to retire, you're looking at a 40-50% penalty on that monthly, or that Part B monthly premium, if you don't have these forms showing that you had credible group coverage. Okay. Now, let's look at Medicare Choices at a glance. Okay. Now, as far as Medicare Choices, once you go on Medicare, you have one or two routes. It's a fork in the road. There's only two ways to go. What would you like to do? Do you want to go with original Medicare, which is Parts A and B, or do you want to take Medicare Advantage? Now, this I find very critical for folks because of the fact that, I'm sorry about that. I find that very critical for folks because you wouldn't, my suggestion is you always should look into all the products available. See what's available within the Medicare world, because remember that 6-month open window once you get that Part B, where you can choose any plan you want. Well, if you went with a Medicare Supplement plan, even if you were on your deathbed, you can get a plan, no problem. Okay, but after 6 months, you have to go through medical underwriting. So what I'm trying to say is, you can be denied a Medicare Supplement plan. Medicare Advantage plans, you will never get denied, but you can only enroll at any time. You can only enroll between October 15th and December 7th, and then it takes effect on January 1st of the following year. Okay, so, but my suggestion, and one of the things that we stress all the time, is look into everything, all the aspects of Medicare, okay, whether it's original Medicare or Medicare Advantage. Because once you're past that 6-month window, you might not be able to go back. There are certain scenarios where you can go back, but you might not be able to go back because, and you might get stuck with a product that might be an inferior product. And again, I've had situations where people are like, oh no, you know what, I'm going to take something, I don't want to pay anything. And then now they wind up getting, huge monthly out-of-pocket expenses. And then they turn around and it's like, you know what, I want to go into a Medicare Supplement plan, which is going to cover me more. I'll pay the monthly premium this time. Well, guess what? Now, you've been diagnosed with liver cancer, or now you got diabetes over 50 units. I'm sorry, but you're not going to get a plan. So you're going to have to stay with whatever plan you have. Okay. So it definitely makes it harder on somebody. So do your due diligence, check and see what plans are available. What is the best plan for you? What is the, because this plan could be the plan that you're going to have for the rest of your life. Okay. Now, Parts A, original Medicare, I'm going to just go into them now. Original Medicare, Parts A, B, and Part D, which is the prescription drug plan. Now, those cover about 80% of all hospitalizations, and now you'll see in a future slide exactly what it covers. But the way it works is you get A, B, and D are together, and then you will get a Medicare Supplement or a Medigap plan, excuse me, that will cover the basics, anything that's not covered by original Medicare. Okay. Well, there is a monthly premium involved with a Medigap plan. Okay. And as far as any kind of out-of-pocket expenses, is very minimal. All right. I think if you had, like, say, for instance, a plan G, you're looking at about a $200 a month deductible or out-of-pocket expense for the year, and then all you have to worry about is your medical, your monthly premiums. But once you go into a hospital or the doctor, after you satisfy that Part B deductible, once that's satisfied, you don't pay anything. Everything is any Medicare approved amount is covered through A, B, and the Medigap or the Medicare Supplement plan. Okay. 98% of hospitals in the United States take original Medicare, and about 92, 93% of doctors in the United States take Medicare. So you can be anywhere within the United States, and you'll find a doctor or a provider or a hospital that takes original Medicare. Places like Sloan Kettering, John Hopkins, Hospital for Special Surgeries, they all take Medicare. So if you needed to go there, you can just, no problem, you can go. Whereas with a Medicare Advantage, which is that HMO or PPO, which is that Part C, the misnomer, since that combines A, B, and D, and it is an individualized plan. Okay, it's an individualized, run by an independent insurance company. You have to go to their doctors and their hospitals. Okay, most of the time it's within a region or an area that you would have to cover that only covers that Advantage plan. Some places could be county-wide, some places could be statewide. There are a couple of companies out there that you can get plans where if you wanted to go on Medicare Advantage, you do have a nationwide network, which you're able to find the doctor if you're on vacation, let's say down in Florida or Arizona, wherever. Whereas with original Medicare, you can go anywhere. All right. So Medicare Advantage plan, it is a privatized plan, as I mentioned, and it is definitely centralized. It could be to a region or an area. Okay. With these plans, they do have bigger out-of-pocket expenses. The maximum out-of-pocket expenses for this year is $7,600. If that's for an HMO, there are certain plans that might be less, but they do apply a monthly premium to that. With a PPO, it could be as much as $10,000, or actually a little bit better than $10,000. And the reason is that once you're out of the network, you would have additional out-of-pocket expenses. Where, as I told you, with original Medicare Part A, if you go into a hospital and you have original Medicare with a supplement plan, you don't pay anything in the hospital. You're 100% covered. Whereas with a Medicare Advantage plan, depending on the plan, they might hit you with $200 a day for 5 days, or $300 a day for 4 days, or $500, a one-shot deal of $700, or for 2 days, something like that. You basically wind up spending about $1,400, up on per hospitalization, per whatever amount of days, up until you hit that $7,600 mark, or a maximum out-of-pocket expense. Okay. Whereas if you went to like a CAT scan or MRIs, things like that, they do have deductibles that you would have to pay, out-of-pocket expenses, 10%, $100, $200, depending on the plan. Since they are with a Medicare Advantage plans, as I mentioned before, they do have to give you the parts of original Medicare. They do have to include the parts of original Medicare, but after that, once they include that, the individual insurer, they can jiggle it here and there and put in different scenarios for it. In these cases, the Part D, in most cases, the Part D is included with the Medicare Advantage. In some cases, they will give you glasses and dental included also with these plans. They'll give you a percentage of it. In some parts, they'll give you maybe $1,000 a year or $1,000 every 2 years. I've seen plans for $200 a year for dental and $200 for vision, like that. So they do give you some sort of copay along with it. Once you get into the better plans, then they will give you you will be subject to a monthly premium. Okay. And another thing to keep in mind is you cannot get Medicare Advantage and you cannot get Original Medicare at the same time. All right. And as I said before, analyze what you're looking to get the best product for yourself. Okay. Because these plans, it could be the last plan that you'll be eligible to get at that point. Okay. In your life. All right. So just to get to look at the comparison of the two, okay, what is the relationship for Medicare Parts A and B? The Medicare Advantage or your Part C replaces Original Medicare Parts A and B, and where Original Medicare with a Medicare Supplement Medicare Supplement actually supplements A and B. Okay, is a privatized network required in most Advantage plans? Yes, it is. In Original Medicare, no. Again, you can go to any doctor or any hospital that takes Medicare. And mind you, Medicare is primary. You don't go into a doctor and say, "Do you take my supplement provider?" No, they take Medicare. Medicare will then, in turn, whatever Medicare doesn't pay, will send it to the supplement provider. It's really not the doctor's. The doctor should, the Medicare is the one that takes care of that. All right. So are referrals required for Medicare Advantage? On some plans, yes. Again, it's an HMO or a PPO, so you might need a referral. With Original Medicare, no, it is not. With a supplement, you do not. You can go to any doctor or any hospital you want anywhere in the United States, no problem. All you need to do is make sure they take Original Medicare. Is the Part D included in most plans of an Advantage? Yes, it is. Although you still do have the copays and the deductibles that the Part D plans, in most cases, you do still have the deductibles and copays along with it. Okay, is the Part D is not included in Original Medicare with a supplement plan, that you would have to pay for that separately, as I mentioned. Monthly premiums for these plans, they vary, but they're generally lower as far as the Advantage plan is. With Original Medicare and a supplement, the supplement, yes, they vary. It's generally a little bit higher as far as what the plan is costing. But I look at it this way. With a Medicare Advantage plan, you could have, I have annual out of pocket of $6,700, but that was last year. This year it's $7,400 or $7,600. But anyway, when you're looking at a Medicare Advantage plan or Original Medicare with a Medicare Supplement plan, even though you're paying a monthly premium, let's say about $150 a month for that supplement plan, which is basically in the middle for a 65-year-old, you're looking at $150 times 12. It's about $1,400 or $1,500, whatever it is, whatever the math is. Plus, if you had a Plan G, plus the $200. So it's going to cost you $1,500, $1,600, $1,700, let's say $1,700 for that Medicare, your Original Medicare with a supplement plan. Okay. But that's all you're going to be spending. You're not going to be spending on anything else. All right. Whereas with a Medicare Advantage, let's say somebody comes up with some sort of, let's say, a cancer in November. You go through around the chemotherapy with all the drugs and all the testing and everything else. You're going to hit that annual out of pocket. So you're going to hit that $7,000, during that time. And then since it reloads on January 1st, okay, now you go for a second round or a third round or whatever it is of chemotherapy. Then what happens? You're going to hit that $7,000 again. So potentially within about a 3 or 4 month period or window, you can be looking at a $14,000 debt. Okay, which that doesn't happen with Original Medicare and a Medicare Supplement plan. Medicare Supplement plans, you do not lose. You'll always have that plan. obviously as long as the company doesn't go under, but you'll always have that plan. The only way you can lose a Medicare supplement plan is if you don't make your monthly premium. Once you stop paying your monthly premium, then obviously you do have a grace period. After that, you lose that month. You lose the supplement plan. And again, be careful with that, because if at a point you do not, if you're past that 6 month period and you have issues, then you might not be able to get back into a supplement plan unless it's guaranteed issue, but that's certain scenarios. We're going to go over that. Are these plans guaranteed renewable for life? Not with a Medicare Advantage. No, it's not. And as a matter of fact, the individual insurer can opt out of a certain area, and then you'll be stuck looking for another plan within a certain period of time, which again I'll go over. But they're not renewable, and usually between October 15th and December 7th, you should be looking at your plans all over again and see what's available at that time, and see what you can get at that period. Okay. With original Medicare, it is definitely renewable every year. You never lose it, like I said before, and the only way you lose it is if you don't make that payment. Okay. Now, I'm going to go over what the different plans, or certain different plans, well, actually the three major plans within the Medicare supplement world: plans F, plans G, and plans N. Okay. As you can see in plan F back in 2017, we sold about 7% of our policies were plan F. Plan G, we sold the majority of policies that were sold were plan G. And then we had a smaller number of policies, the plan N, we sold the balance of that. Now, as you folks well know, once an insurance plan comes into play, the better the plan, the more expensive it's going to be. And that's exactly the same with the F, the G, and the N. Okay, the plan F covers 100% of everything, but it's costly. The plan G does not cover your Part B deductible, but it's less than a plan F. So what happens? There are certain scenarios where you can look at certain individual insurers and pay over $200, that the Part B deductible. You could pay $400, $500, $600 more a year for a plan F than a plan G. So our suggestion is, why bother giving an insurance company $400 or $500 more when all they're going to do is satisfy $200 for you? Why don't you satisfy the $200 on your own and get a less expensive monthly premium, and take the other through $200 or $300 and pocket that. And by the way, as time goes on, it will cost more. The plan F and the two plans do go up on a yearly basis, anywhere from 2 to 4 to 5%, depending on the insurer themselves. So after a certain amount of time, it does get costlier. And if you had a plan F, it could come out very costly, and it could cost you. I've had situations where I've had to save folks $1,200 a year per person, switching from a plan F to a plan G. The plan N, there's three things that it does not cover. It's a less expensive than a G and an F, but it doesn't cover, again, it doesn't cover that Part B deductible. Also, the plan N includes copays, which the G or the F do not. It's $20, no more than $20 for a doctor or specialist, no more than $50 for an emergency room. And the plan N also does not cover the excess charges. We'll go over that in a couple of seconds. Let's go and show you what exactly the plans cover. Now, the reason I put a plan F example here for your Part A is because whether it's an F, G, or N, or the F, G, or N, which are the three major plans, they're exactly the same. The Part A of original Medicare with any plan is exactly the same. So what happens here? Medicare, if you're staying in the hospital 1 day or 60 days, so the first 60 days that you're staying in the hospital, if you only have original Medicare, you're going to spend $1,408. They will bill you $1,408. If you stay from day 61 to day 90, so an additional 30 days after that, or additional month, Medicare, you're going to be hit with that $1,408 plus $352 on a daily basis, because that's what Medicare does not cover. from day 91 and thereafter, up on and using the 60 lifetime reserve days, so that's up from day 91 to day 150, Medicare will not cover $704 on a daily basis. So as you can see, that could add up if you spend, a significant amount of time in the hospital. So now you have yourself a Medicare Advantage plan, a Medicare Supplement plan. So what happens with that Medicare Supplement plan? That $1,408 is covered with the supplement plan. The $352 on a daily basis is also covered, and the $704 is also covered. So as you can see on the green slide section of the slide, you pay nothing. Okay. Additionally, a Medicare after your 150 days, Medicare doesn't cover anything further. Okay, but as you can see there, anything past after the 150 days, you get 365 additional days. That's not covered by Medicare, but it is 100% covered by your Medicare supplement plan. All right. And so in essence, you're looking at 515 days of continuous coverage that you can be in the hospital, God forbid, but you can be in the hospital and will not be spending a dime. Okay. Obviously, after that 515 days, then all cost is on you. Okay. Now let's say, for instance, you get out of the hospital, you're going into a skilled nursing facility. So the first 20 days that is covered by Medicare. All approved amounts is covered by Medicare, all Medicare approved amounts. So you're not paying a dime. But if you went from days 21 to day 100 in a rehab or any kind of skilled nursing facility, you're going to be paying $176 a day. With the Medicare supplement plan, it takes it. You don't pay anything. It's all covered. Okay. After 101 days, you're paying the balance. I say hop out of the skilled nursing facility, hop back in and re-register. I didn't say that. So for whatever reason, the first 3 pints of blood, Medicare does not cover the first 3 pints of blood. So you had to go for some major transfusion or anything like that, and some, God forbid, some sort of accident or something, and you needed 3 pints of blood, the first 3 pints is going to come out of your pocket, but not if you had a Medicare Advantage plan. Oh, again, a Medicare Supplement plan. I apologize. That will be covered 100%. Okay. Any kind of hospice care or any kind of in-home care that's affiliated with any kind of terminal illnesses or anything, that's all 100% covered by Medicare and the Medicare Supplement plan. So as I mentioned before, the Part A or any kind of hospitalization, if you have original Medicare with a Medicare Supplement plan, you're not spending a dime in the hospital. Okay. Now, let's go to the Part B portion. Okay. The Part B portion of Medicare is you're looking at, generally Medicare only pays about 80% of any kind of doctor visits or any kind of testing or anything like that. But I apologize, that $198, which is a Part B deductible, is actually $204 this year. But that Part B deductible will be coming out of your pocket. Okay, if you had a Plan F, as you can see on the green on the you pay section, you're not paying anything for it. That's 100% covered. Okay. Any kind of the Medicare Part B excess charges is all covered. Now, the Part B excess charges is any amount that's above a Medicare approved amount. So, for instance, if the doctor bills Medicare $250, but the Medicare comes back and says, "No, I'm sorry, we're giving you $200 for that procedure." Okay, anything 15% of the balance can be passed on to you. Okay, so that's a Part B excess charge. You don't have to worry about that with a Plan F. That's all 100% covered. Again, if you had a Plan F, everything's 100% covered with doctors, hospitalizations, everything. Okay. Any diagnostic testing, everything is 100%. So Plan F is a great plan. I'm not gonna say no, but it's a costlier plan. Okay, and that's why we sold less in 2017 and in prior years after that also. We generally sell Plan G more than a Plan F. Okay. Additionally, and this is all covered by the Medicare plan, the Medicare with the supplement. If you had, again, durable medical equipments, any kind of skilled nursing care, that's all covered 100% with the plans. You don't have to worry about that. But remember, the first $204 deductible with a Plan G, you're going to have to pay, not with a Plan F. That's all covered. Now, the other thing, the other benefits not covered by Medicare, as you can see there, which is foreign travel, that's not covered by Medicare. Okay. The Medicare Supplement plan does give you an additional, this is an additional coverage that they offer or that they have. And again, or whether it's an FG or N, it's exactly the same. They do give you a $50,000 maximum lifetime benefit. Okay. Whereas if you're traveling outside the United States, you're on foreign territory and you get hurt and it's an accident, you have a $50,000 maximum benefit that they will pay 80% of after a $250 deductible. So you pay the $250 deductible and 20% of whatever the cost is. And let me tell you something, $50,000 outside the United States, it's a lot of money. All right. So you do have in some sort of travel insurance along with, with the Medicare Supplement plan. I'm not going to tell you that if you're going to travel not to get Medicare or some sort of travel insurance, because I had a situation where a lady one of my clients lost, she broke her leg and she broke it in such a way that she had a huge cast. Well, Medicare, the Medicare Supplement plan did cover the cast and everything else and the doctor visits and all that, but she couldn't get back on a commercial airline. So what happened was she had to pay an additional amount for that, for a private plane to be jetted back to the United States. That was a $20,000 tab. She had she did have travel insurance. So, thank the Lord, she was able to, that was covered by the travel insurance. Okay. So again, you're going to travel. Yes, you do have coverage, but I'm not going to tell you not to get the travel insurance. I suggest you do also. What's the difference between a Plan F and a Plan G? As I mentioned before, the Plan G has that one-time deductible, whether it's the very first doctor visit or the very first, let's say, the pints of blood that you go, or the very first MRI or blood work that the doctor tells you, you will be paying the Part B deductible if you have a Plan G, and this year is at $204. So, that's the difference between the two. But again, the monthly premium is substantially less between the G and the F, and that's why we suggest the G again. The difference between the Plan N and the Plan G, once again, you still have that Part B deductible of $198 or the $204, excuse me. But in this case, as I mentioned earlier, you do have a $20 copay for doctor visits and specialist visits, no more than that. You do have a $50 copay if you went to an emergency room visit. Now, if you stayed overnight at the hospital, now it becomes Part A of Medicare, and that $50 emergency room visit is waived. Okay, but that's if you stay overnight. And again, another thing that's not covered by the Plan N is the Part B excess charges. You will have that 15% is basically all on you. Most doctors will just take whatever Medicare, gives them, or bills, whatever Medicare gives them, they'll take that, but it's not written in stone. So you can be, hit with a Part B excess charge. What's the difference in pricing between a Plan N and a Plan G? It's not much, depending on the company. It could be $100 in some cases. I've seen that, but generally it's about $20, $30. So most people opt to just pay the additional $20 or $30 a month and not have to worry about excess charges or doctor visits and things like that. Okay. So that's the differences between the plans. Now, let's go to a Medigap open enrollment. As the Medigap open enrollment period, as I mentioned before, you do have that 6-month open enrollment period where you can get any plan you want within after your Part B becomes the effective date of the Part B. Okay. So, and then after that, you will be going through medical underwriting, and they will ask you medical questions as far as what's what kind of diabetic or any kind of conditions. You will be going through medical underwriting. Okay. Once again, if you're within the 6-month or during the open enrollment period, you can get any plan you want. My suggestion as always is get the least expensive plan with an A-rated company. Find yourself a good company. Some people like, listen, I've been with Aetna all my life, or I've been with United Healthcare all my life. If you want that, that's fine. Here's your monthly billing. But remember, Medicare is primary. So whatever Medicare says, that no matter which Medicare supplement plan you have, they have to abide by the rules of Medicare, and they will pay whatever Medicare says, whatever Medicare does not pay. Okay. Your doctor does not need to know who your Medicare supplement plan is, although I suggest you do show them the card so that they'll have an idea who's going to be paying them. But the critical thing is, you don't walk in and say, listen, I have Aetna as a Medicare supplement plan. Do you cover it? No, no, no. I take you take Medicare, then here's my Medicare claim card. Here's my supplement card. You're billing Medicare. Okay. And a lot of people have a misconception that they think that the doctor's got to go through United Healthcare or an Aetna. No, that's not true. If you have a supplement plan, it's original Medicare is what the doctor takes. Okay. So again, let me go back to that open enrollment period. You have that 6-month open enrollment and in order to get the Part B plan that you want. And again, like I said, I would go with the least expensive plan as far as with an A-rated company. Okay. Now, let's say you had your Social Security, you were collecting your Social Security disability Medicare, and this was prior to 65. You do have an open 6-month open enrollment that you can get a Medicare plan. There's certain ones in here in D is the plan, I believe it is. Anyway, D that you can get if you're Medicare disability prior to 65. But once you turn 65 on your eligibility month, okay, that's September, whatever, you do have another 6-month open enrollment period. So it's a good idea to take a look at that those plans at that point, and see what the cost would be. And maybe you can get yourself a less expensive plan than what you previously had with the disability plan. Okay, so those are scenarios that you would need. At the age of 65, and within the Part B, that's your open enrollment period, within the 6-month open enrollment period from the effective date of the Part B. Okay. Now, there's also what's called guaranteed issue. Okay. You can get guaranteed issue plans with no medical underwriting. If you were eligible for your Medicare prior to January 1st of 2020, last year, then you can get your guaranteed issue plan will be the plan F. Okay. Prior or after January 1st, after January 1st of 2020, your guaranteed issue will be the plan G, okay, which is good because the G is the lesser expensive of the two, so that's fine. But again, if you were eligible for Medicare prior to January 1st of 2020, so December, let's say December of 2019, you were eligible for Medicare on that or before, then your guaranteed issue plan will be the plan F. Which was a quick point. If you were eligible after January 1st of 2020, you cannot get the plan F any longer. They stopped anybody on that time, and after whoever's Medicare eligible at that time, then you cannot get the plan F, because the reason being is that they want you to pay for that Part B deductible. Okay. Most people just take since if they have the plan F, nothing covers me, so they'll just go to the doctor for any kind of sniffle or anything. So, Medicare figures they're spending too much money on frivolous, bills. So they figured, if we force the people to pay that $200, they might think twice about going for just a sniffle or something like that. So, again, it's $200 for, with Medicare. It's a great product. Medicare's a great product. It's $200 if that's all you're gonna spend on your monthly premiums. It's absolutely phenomenal. The guaranteed issue scenarios. Let's say you had original Medicare, and as you can see there, your employer group health plan, including your COBRA, retiree, or union coverage that pays after Medicare, and that plan all of a sudden comes to an end. You have a 63-day window in order to get a guaranteed issue plan with no questions asked. That's right after the date of the coverage ends. Okay. Even if you have no notice, the notice that you're given, that's the date. You have 63 days from that day in order to pick up a plan. Okay. If you were in a Medicare Advantage plan and your plan is leaving the area, or stops giving care within that area, or you move out. That's another thing about a Medicare Advantage plan. If you decide to move out of an area once you get to your new home in whatever state or whatever county it is, then you'll have to reapply for Medicare Advantage at that point. Okay. You do have, if you know you're leaving or the company's going away, they will notify you. You can apply for guaranteed issue plan 60 days prior to the date of this enrollment and 63 days after that plan ends. Okay. You've had a trial right. Let's say you had a Medicare Advantage plan and you decided to check it out and see what the situation was with it. And now you realize that your doctors are not in network or whatever the case is. You decide not to do this. Well, within the first year of you joining that particular plan, once again, it's the same formula: 60 calendar days prior to the when the enrollment ends, or 63 days after that ends, that you can apply for guaranteed issue for a Medicare supplement. Let's say you had a Medigap plan for years and you decide, you know what, I'm paying a little too much for this thing, so I'm just going to go into Medicare Advantage plan. And all of a sudden you realize that's really not for you. You want to go back to the original, to get a purchase of a Medigap plan again. Again, it's a 60-day prior, 63 days after window. If another scenario is if you had a Medigap insurance and that company you have goes bankrupt, you lose your coverage 63 days after you find that out, you have guaranteed issue rights. If you leave a Medicare Advantage plan and you drop a Medigap policy because the company, what you were told is not true, if you're going into a Medicare Advantage plan, one of the biggest things you're supposed to find out is, will my doctors be in network? Okay, if you're satisfied with your doctors, you don't want to change them. You have to find out if they're within that network of that plan the particular plan that you're looking for. If you've been duped and told that they are and they're actually not, you've been misled. You have that 63-day window once you leave. You just have to tell Medicare that you're leaving because you've been duped at it or misled, and then you do have that 63-day window in order to change. Okay. So that concludes my Medicare part with the parts A and B. And now we're going to get into the fun part. Okay. I got to get a sip of water for this one because the part D it's very, very, it's pretty intriguing. Now, as I mentioned earlier, Part D plans are privatized plans, but CMS, local or state and federal government, tells the insurer, the different insurers, that they have to abide by certain rules. Okay. Within those rules is going to be how much of a deductible, the maximum deductible that they're able to put in, when the person's going to, or their amount is going to hit the individual, or what's called the donut hole, or the coverage gap, and when it's supposed to come out and all that. Okay. What they generally do, each company, they tier their medications in a certain weight. It could be a tier 1 medication up to a tier 5. Tier 1 being a plan or a medication that's a generic. Tier 5 and going all the way up to a tier 5 where you're looking at a medication that might be a specialty medication. Once you get over tiers 3, 4, and 5, now you're getting a costlier medications. So this can run pretty. It can be very costly for you. But the one thing that the government says, and CMS tells the insurers, is that the annual deductible for this year cannot be over $445. Okay, could be less, but it cannot be more. Okay. Another thing is, once you are satisfied with that annual deductible during the initial coverage phase, what's called that initial coverage phase actually goes up to $4,130. Now, that is based on the retail cost of all your medications combined. So once the retail cost of all your medications reaches $4,130, all right, that's not what you're paying. That is what the retail cost of the medications. Remember, what individual plan you're in is going to take part of that. It's going to, they're going to give you a copay, or or some sort of billing. It's going to be a copay along with it. So you're not going to be paying 4,130. But once the retail value of all your medications combined reaches $4,130, now you hit what's called the coverage gap, or better known as the donut hole. Okay. Once you hit that donut hole, and don't get too crazy, because it's about 14, 15%, 16% of people actually do hit the donut hole. It depends on the type of medications. Some diabetic medications might get you there. Some sort of, maybe some heart medications. It all depends. Tiers 3, 4, and 5. All right, that's when you're going to hit that donut hole. Oh, I'm sorry. I'm going to back up just a second. With the annual deductible, the $445, that deductible only applies to medications that are tier 3, 4, and 5. If you're on a medication that's tier 1 or 2, there's no, you don't pay the deductible. You don't pay the annual deductible at all. Okay, those are for less costly drugs. That's the tier 1 and tier 2. So if you're in that area, you don't have to worry about paying the deductible whatsoever. Okay. Uh, Again, since the companies tier their medications differently, one company could take, like, for instance, a metoprolol and tier it as a tier 1. Another one could actually put it in as a tier 3. So now you're hitting that annual deductible. Okay. Uh, Going back to the coverage gap in the donut hole, once you hit the coverage gap, or your retail value of all your meds exceeds $4,130, now you're going to be coming up with paying 25% of that medication. Okay, so if it was a $400 med, you were paying, during your initial coverage, you were paying like a $25 copay. Now you go into the pharmacy, and the pharmacist goes, "All right, you owe $100." And we're like, "What are you talking about? I was paying $20 for that med last month." He says, "Right, but since you hit the donut hole, or you're in the coverage gap now, you're forced to pay 25% of that medication. So if it's a $400 medication, now you're looking at $100." Okay. In order to get into the coverage gap, like as I mentioned before, it's not like you're spending $4,130. It's about roughly $2,000 to get to out of pocket, that with your medication you'll be paying, that'll drop you into the donut hole, and it's roughly another $2,000 to $2,500 to get out of the donut hole. And as I mentioned before, now, how do you get out of the donut hole? If you see there where it says $6,550, that's once you hit that number, which is called the true out-of-pocket expense. Once you hit that number, you come out of the donut hole. How do you hit the troop? Well, what's the troop? The troop is what the pharmaceutical discount for that, or the actual cost of the pharmaceutical company for that drug, plus whatever you're paying, plus whatever your actual plan pays. Once they take all that into consideration, that's the true out-of-pocket, or the true out-of-pocket cost for those meds. That's how the coverage gap, or the troop gets calculated. So once all those figures hits the $6,550, you come out of that and you go into what's called the catastrophic coverage. Okay, and as I just mentioned, you're not paying $6,550. It's about $2,000, roughly, to get out of the coverage gap. Again, 15% of the people actually hit the coverage gap, and then once you're in there, about 5 or 6% actually come out of the coverage gap and then hit into catastrophic coverage. But once you hit catastrophic coverage above the $6,550 true out of pocket, or true out of pocket cost, that medication will cost you 5%, or $9.20 for a brand name. This is for 2021, or $3.70 for a generic medication. Okay. At that point, obviously, your medical bills will be drastically, decline. Your RX plan, I'm sorry, your RX bill will be drastically declined at that point. Okay. So these are the scenarios that, like as I said, CMS and the federal government tell them, okay, you cannot exceed these numbers. All right, these are the numbers that it's the 4130 to get out of the initial coverage and into a coverage gap, and the 6550 get out of that. So this is the scenario that the insurance companies, or I'm sorry, the federal government put on the insurance companies themselves. Okay. Um, when you're looking at a Medicare prescription drug plan, it's very critical to. Well, I use Medicare.gov. We use Medicare.gov. There's a scenario. There's different scenarios in order. There's 4 different scenarios for the where it actually tells you which is the best plan. So Medicare.gov is a great tool to use. It takes into consideration the price of the medications, what the annual deductible is, any kind of co-pays that you might have, and it also takes into consideration, believe it or not, who's the preferred pharmacy, okay, preferred provider for a pharmaceutical company. Once it takes all of those 4 factors into consideration, it'll tell you which is the best plan for you, and it's basically which is the least expensive plan of all. Okay, these RX plans are very individualized. Okay, your buddy's RX plan is not going to work for you because you take different medications, different dosages from what your buddy or your spouse or your aunt and uncle take. It's a very individualized planning for RX. Again, we go through cms.gov, you input your medications, the dosage, the times per day that you get, the amounts that you would pick up at the pharmacy on a monthly basis. And then it'll calculate it all out for you and tell you which is the least costly plan. And that's the plan that's the best for you. Okay. And I want to show you how this setup worked out. We had a gentleman come in. This is an actual plan or an actual medications that a gentleman came in. This was a few years ago. And he came into our office and he said to us, all right, he came in, he signed up for his Medicare, his Medicare Advantage supplement plan. And now he wanted to go through the Part D. And we told him that, he says, listen, he goes, my buddy's got a $39 plan. My neighbor has got a $39 plan. He swears by it. He says it's awesome for me. He's awesome for him. That's the plan I want. So we calculated all those medications and we put it on the through Medicare.gov. And like I said, this is an actual list of his medications. And we told him that no, the best plan for him is this particular card, and the monthly premium on this plan is $98.30. This particular plan had no annual deductible, okay, and the total cost was going to be $4,800 for the year, okay. As you can see, his the monthly totals or the full cost of the medications was called $1,669. So he was going to hit that donut hole right away. Within 3 or 4 months, he's going to hit that donut hole, okay. During the initial coverage, he would be paying $611 out of pocket for all these medications. During the coverage gap, it actually went up slightly to $781 for the payment. And then once he got out of that and came into catastrophic coverage, he would only be paying $88 or $89, under $90 for his plan. So we told him this is the best scenario plan for you. And he's like, no, I want my buddy's plan, my neighbor's plan. It's only $39. So we looked at his buddy's plan, and this was the scenario that popped up. His buddy's plan, that $39.20 plan, as you can see in red, the Cinemet and Zocor and Zoloft in his buddy's plan were not covered. Okay, so he would have had to pay those 3 medications out of pocket, the full retail value of those medications on a monthly basis. So what was the cost was going to be for if he chose his plan? By the way, once you choose that plan January 1st, once it starts on January 1st, you can't stop it. Your next plan, the next time you opt into another plan is October 15th to December 7th, and that'll start January 1st. Okay, so once you enroll in a plan, that's it. You're going to be that's it for the year. So if he would have took his buddy's plan without analyzing his RX medications, he would have wound up spending $12,800 a year because he took the wrong plan. Okay. We strongly suggest every single year you do your RX plan between October 15th and December 7th. That's my busiest period. But that's something that I do for all my clients. I email them. Here's your list of medications. Please, if there's anything different, let me know. I rerun every single plan for them on a yearly basis, and I do this all at no cost. And I send it back to them, and okay, this is your best scenario plan for you for this year, this upcoming year. You can either keep, if you keep this plan, it's going to cost you this much. If you keep your present plan, it's going to cost you this much. Or you can switch this plan, it's going to be less expensive for you. Okay. Even if your medications don't change, the plans do. They reweight the medications on a yearly basis. They do adjust the plans on a yearly basis. So you should look into these things no matter what every single year. Okay. So as you can see, that $39 plan was going to cost them $12,800. And then just to show you guys and show, as we showed him, that it had nothing to do with the monthly premium. It has to do with the actual drugs that are involved. As you can see, we showed him another $97 plan for monthly premium. That plan had $325 deductible, but a fourth medication, the Selenique, was not going to be covered in that plan. So now he would have been spending over $16,000 for that plan, because now it's a fourth medication that's not covered, which he would have been taking out of pocket. Okay. So this is why I insisted earlier. This is very, very critical for everybody to look at the plans, the actual RX plans that they have on a yearly basis. Do it every single year. Use Medicare.gov if you like. They do make it easier for you. Again, my clients, I send them an email with their medications, like, please adjust your medications. Have you changed? Have you not changed? Is there anything new? There's something taken off, whatever the case is, let me know. I rerun all of the medications again on a yearly basis, and then I send them back out, let them know whether they should change or whether they should keep the present plan. All right. So that concludes my my presentation, folks. The number one rule, as I mentioned before, the 5 rules or the 5 mistakes that people make. The number one mistake is not enrolling in your Part B on time. You have to be very critical of the initial enrollment period. Be very careful, because you do have that 10% penalty on a yearly basis. Be careful with that Cobra trap. Look at your retiree plans. This is critical, because some folks could have, oh no, my company's giving me a retiree plan. I'm paying $100 a month for it, but they got a $10,000 deductible or something like that. So you look into it. You have a $10,000 deductible. You're still paying $100 a month. Could you get away with a Medicare Supplement plan and look at only a $200 deductible for the year? What's going to be less costly for you? Okay, so even if it's your company's old retirement plan, analyze it. Do your homework. How much is this going to cost me? To how much can I get with Medicare, original Medicare? See what the difference is and see what works better for you. The bottom line is what's going to be less expensive. Okay. And again, everybody's different. We're all different. All our medications are different. So you should reanalyze all your plans on a yearly basis, except if it's a Medicare a supplement plan. That's it. That you're good for life. Okay. The number 2 mistake that people make is not analyzing their prescription drug plan. It could cost you thousands and thousands of dollars on a yearly basis. If you continue with the wrong, or if you pick the wrong plan, or if you don't have, if you haven't checked your plan for the following year, there's about 30 to 35 different plans on the market for each state. So, there's a big variation. And what happens, the formulary is key. Where is your medication being tiered from one insurer to the next? Again, it could be a tier 1, which is no cost to you. Could be a tier 3, then now you're getting hit with that $445 deductible. Okay. Medicare.gov is a great tool to use. And again, as I mentioned earlier, your enrollment, the annual enrollment is between October 15th and December 7th. Okay. Number 3, Medicare Advantage versus a Medigap plan. What's best for you? Do I want networks and referrals? What's the maximum out-of-pocket expense? What's my overall expense? What's the changes that can happen? Any extra benefits that happen? By the way, original Medicare does not do anything as far. They don't cover dental or vision. So that's another thing that you have to look into, take into consideration. But what's going to be less, what's going to be effective for you. And again, it's critical to pick the right plan now because you don't know what's in store for you tomorrow. No, nobody knows what's in store for us tomorrow, what can happen. And all of a sudden, if we're stuck with the wrong plan because we wanted to save a couple of shekels here and there, the year before, now you got that plan for the rest of your year. That's a possibility. So be careful with that, folks. Number 4 is, as I mentioned earlier, analyze your retiree coverage as to what your company's going to give you, as to what you can get with Medicare. What's the co-pays, how much are the premiums, is there any co-insurance, compare all expenses between one and the other and see what's better for you. And the number 5 mistake that people make is listening to your friends and family. We're all individuals, all our medications and all our doctors and everything is different. So, what I like to do is I always tell everybody, listen, look and see what the information is, look and see what the what you need, and then we'll go from there. I lay out the products for everybody. This is the cost for that. This is the cost for this. What do you need? What's the best scenario for you? What fits in your budget? And then you make up your own mind. You make up your own decision after that. Here's my name and my number again. My email information. If you want to email me, I will be more than happy to send you a copy of this presentation. You can call me and any of the numbers, and we can discuss any of the plans. Once again, I do not charge anything for my services, so I'll be more than happy to help out. I am commission based. So it doesn't come out of your pocket, but I will, inform you of everything that's available, and you can go from there. All right, you can make up your own mind. Thank you, Kathy.
Great, thank you.
All right. Well, folks, as I've mentioned before, please feel free to give me a call. Feel free to send me an email. I will send you a copy of the presentation. If you have any issues, any questions, I'll be more than happy to help out, and let you know what's going on. All right.
All right. Okay, so thank you, Mike, for taking the time to present on this topic and for answering all of our questions.
Kathy, I can't thank you and the East Brunswick Public Library for what you do. You guys do. This is a great service for folks that don't understand and could cost them a ton of money. So it's a very good product. It's a very good presentation to do.
Yeah, thank you.
Thank you so much. All right, folks.
Yep. And then for everyone, thank you for joining us today. And then also please join us for our other health programs. We have a lunch and learn about asthma this Friday, May 7th at 12 p.m. A lunch and learn about stroke on Wednesday, May 12th at 12 p.m. And for more information or to register for these programs, you can check out the library's event page at ebpl.org/calendar. So thank you everyone for joining us for today's talk. Take care and stay safe.
Thank you, folks. Take care now. Thank you, Kathy.
Thank you. Thank you, Mike.
Bye-bye now.
Thank you. Bye-bye.